okay? Give me 5 minutes of your time to help you tune in to your body's messages so that you can hear if your liver might actually be silently screaming from deep inside. I'm Sienna Songbird, and I am a chronic illness warrior. I was taken down at a young age, so I've had over 12 years of time to dive in deep and study and explore these topics and dig myself out and come back out and, recovered. And now I am passionate about helping you and those who truly want to heal and are up for that kind of challenge and adventure to, find the straightest, forwardest path to get to that root cause and not waste too much time in this, complicated and challenging journey of true healing. So come with me if that sounds like something you are up for. Today I'm going to talk about, the liver. There's a lot of times we think that the liver is not in trouble unless, our lab panels show something irregular or we show up on a scan with fatty liver. But by the time those things show up, the liver is already over 80% compromised. And that's like, parts of the liver are dying and black. So we don't necessarily want to get to that point. And why is the liver kind of silent in its suffering? Because it is so crucial to our survival. It just does everything it can to keep us going. So it's a really selfless servant in our bodies. And so what I want to do today is kind of introduce some possibilities, some categories that you might look out for to check in with your own system. Is there some signs here? Are there some quieter messages that the liver is asking for some attention, that it's needing some support? So one of the ways that we want to check in this is, how is our sleep quality? And especially, how do we feel upon waking? Is there any kind of sluggishness? Is there any kind of hungover feeling? This is really a clear sign that there's dirty blood happening, that the full cleaning that the liver is supposed to do during the night isn't quite happening. Now, another category that's really big for liver and gallbladder issues is the digestion. So you might think it doesn't have to do with the liver, but it has everything to do with the liver, including low stomach acid, low digestive fire, constipation or diarrhea, bloating, gas issues, pain, reflux. If any of these things are bothering you, or food allergies, sensitivities, trouble digesting certain things, this can all sort of lead us. It's a hint. It's actually a pretty obvious sign that the liver needs some addressing, some support. Now, another one you might not make the connection with, the third one I want to talk about, is the skin. So the skin might be expressing, let's say, rashes or eczema or acne, or hives. Some of these things express and they happen in a chronic way, and that's because the liver is basically overloaded and it's sort of backing up into the next detox system, and one of those is the skin. So if you have some of those kind of tricky skin issues, and again, they don't get taken care of very well topically, and that's because it's this inner underlying root problem. What about musculoskeletal issues? So again, not obvious things that have to do with the liver, but rigidity, inflexibility, joint issues, knee issues, shoulder, frozen shoulder, pain, radiating on the right side, or, obviously pain in the right liver area is clearly liver, but all of these things, the tendons and the joints, are governed by the liver. Another huge category would be hormonal. So we can look at everything, the women's menstrual cycle, the emotions on that, the processing throughout the month, the pain or comfort or discomfort around those cycles can have a lot to do with the liver. And the liver is metabolizing hormones, recycling hormones, creating hormones. So if anything in the hormonal sphere is off as well, that can be a sign to take a look at the liver. Also, just to mention, like, if you have named conditions, other diseases, a lot of them such as like mast cell and autoimmune things and all these different GI issues and then also mental and emotional things, especially anger issues, depression and anxiety. A lot of these can really be connected to sort of this overflowing bucket of toxicity, that the blood isn't getting cleaned enough and we're just having this sort of hyper reactivity to the world, to our foods, to the chemicals, to our environment, to our experiences. We're reactive and inflamed. So this is just like a brief overview of some of the things. And actually, I have a checklist quiz for you guys if you want to sort of assess your situation and see if you can hear the scream, the silent scream of the liver. And just see if any of these things could be true for you, or how much of it might be pointing to a liver issue. If you want that free checklist, no strings attached, it's a little kind of quiz thing. Just drop a comment, checklist, and I will send it over to you for free. Thanks for tuning in. This is Sienna Songbird wishing you a beautiful day, and may all beings be liberated.